Acupuncture, of course, has been used for centuries in Chinese medicine, and it's based on the idea that certain points on the body can be stimulated to create a positive, health-giving response. But many people are wary of trying acupuncture because of all those needles. Well, tests at the University of Adelaide have been conducted on a modified acupuncture technique using a device called AcuSlim that doesn't use needles, and it shows every sign of helping in areas such as weight loss. To talk about that, last week we invited inventor Dr. Dean Richards and the university's Professor John Marley into our Adelaide studio. Dr. Richards, Professor Marley, thank you for joining us this morning.
Good to be here, Steve.
Now, Dr. Richards, this is your baby. You invented the device about 2 years ago. How does it work?
Yes, Steve. This is one of 4 devices we've developed to enable people to treat a wide range of health problems and pain problems conveniently in their home. They all work on acupuncture principles, but now they've found that acupuncture points are on the skin. There's no real need to use needles anymore. These work by stimulating the appropriate acupuncture points through the skin by electrodes on the skin instead of using needles.
Okay, and patients can use it themselves at home? No question about that.
Oh yes, that's the majority use now, particularly for some conditions that require very frequent treatments.
Such as?
It's only practical to use them home.
Treatments such as overweight, smoking, those sorts of things?
Yes, particularly the weight problem and addictions, the smoking, the drug addictions, that type of thing. The treatment of acupuncture points relies on production of endorphins and serotonin that affect depression, that type of thing. They've found now that those with a tendency to overweight have low serotonin levels, one of the neurotransmitters in the body. And they've also found that acupuncture does raise these levels. So this is the principle we use on this, that raising the serotonin levels has an effect on assisting in weight loss, and also one of the adhesive electrodes stimulates the part of the ear where there is a branch of the vagus nerve enters.
Yeah, well, now I was going to ask you that, and you've got one of the devices with you now.
That's right.
Why the ear?
Steve, the ear has a complete system of body acupuncture on it. There's a part on the ear that represents every part of the body.
All right, now, come in here, Professor Marley, if you will, because you and your team from Adelaide University have been evaluating all of this. What's your conclusion? Does it work?
Well, I think that we certainly have to say that it does. When we started out, I have to admit that we were probably a little sceptical. It really seemed a fairly unlikely concept that by stimulating your ear that, you know, this would have an effect on appetite. I think, as Dean says, there are a number of mechanisms, including that little branch of the main nerve that goes to your stomach, which happens to come off to your ear. And the Romans knew that stimulating that was a useful thing to do, because you remember they had multiple courses in their banquets, and it was a real problem trying to get enough room in. So what they would do is get a slave to stimulate that bit of the nerve and have a decent chuck or two, and then you could go on with the next 20 courses.
So, okay, so your evaluation is that this is an effective device to lose weight, as we'll talk about weight for a moment. How much weight can you lose, and over what period of time?
Well, I think that what we did was we applied all of the methods that are used for testing any modern drug or any other intervention these days, and found, as I say, really probably to our surprise, that this was really very effective. Now, it's really important if you're going to lose weight that you adopt a healthy eating pattern. I mean, that is absolutely essential.
Am I right? What you're saying is this is not a substitute for those lifestyle changes that go with proper controlled weight loss.
The lifestyle changes are essential. This is obviously a very useful and very good way of helping you to make those lifestyle changes. And the difficulty for people is making the change and then maintaining the change over a long period of time. And this particular method, unlike some of the medications, really has no capacity to do you any harm at all.
Well, that was my next question. Any side effects?
I think it's because you're not actually using needles, which would obviously require sterility and so on, and you apply this yourself, there really isn't anything that you could do to yourself that would in any way
Right.
cause any harm.
So
And of course, you can repeat it as often as you like.
So, Dr. Richards, in a normal period of treatment, if I could put it that way, say I'm the one, I want to lose weight. How many times would I use it a day, and for what period of time?
Steve, we suggest that in the trials, we suggested they used it twice a day for 20 minutes. Now, that sounds a lot of time, but it doesn't take long to attach the unit. And once it's attached, you can put the little power pack in your pocket and go about your work.
So you don't have to sit in a chair for 20 minutes doing nothing else?
Oh, no. No, once you put it on, I spoke to one who's in the trial yesterday. She said she finds that she just puts it on and goes ahead with the housework while she's treating herself.
Is it suitable for anyone that wants to lose weight, or anyone that wants to, say, give up smoking? Can anyone use it?
Yes, there's no contraindications to using it. Of course, with all these things, you do need motivation to use it. I mean, some people may decide after a while that they like eating so much they won't use it. But if they're motivated to use it, we've found that it's very effective. Now, in the trial, we found the goal weight was to lose 2 kilos in 4 weeks.
Okay.
So after that time, a lot of them we've contacted since have found now that they get into an eating pattern and know what to eat then.
Right.
So they only need to use it if they find that their weight is starting to climb up again. Other than that, they just put it in the drawer and forget about it.
Okay. And the final question, the dollars and cents question, what's one of those units cost?
Yes, the recommended retail is $195.
Okay. Thank you both for joining us this morning.
Thank you very much,
Thanks,
Steve.
Steve.
Thanks.
Dr. Dean Richards and Professor